Okay, good. So welcome all. Thank you for being here today. I haven't seen a line that long in front of the Fed since I saw the pictures down in the West Wing downstairs that has pictures of in the 70s when folks came here to buy bonds. And that line was that long. I don't think there's been a line here that since then. But I think it speaks to the interest in this topic for many people who are here today of having these two sectors come together. I'm looking in the audience and I see a lot of folks that I've known for a very long time, have traveled a long way to be here, and I'm happy to see them again. And then I see folks that I've known very recently since I started working on this topic, and I'm glad to get to know them and see them as well. In early November, we took our bank president, President Williams, out to northern New Jersey for a series of engagements across northern New Jersey. We made several stops. One of the stops that we made was in Newark, and we visited Family Village, which is a new development that's taking place in Newark. And I was very impressed with what I saw, because it's a combination of, it's a healthy housing development. And I think, but what impressed me the most, of course, besides the beautiful development and how these homes looked inside and the quality of it, but really what impressed me was the collaboration among many stakeholders to make this happen, to make sure that it met the standards of healthy housing. And so I think what I want to accomplish with this panel, first, is just stay out of the way of these dynamic speakers. That's my first goal. Second, to finish within 30 minutes. And then third is really, I want to figure out, to tell this story, how did the three of you and other partners who are not here decide to work together, right? How did you decide on to do this? And what were some of the challenges and success of this work, right? So Wayne, why don't we start with you? Wayne Meyer is president of New Jersey Community Capital. Let me introduce also Abigail Suarez, who's vice president of global philanthropy at JPMorgan Chase. And of course, Micheline Davis, who's executive vice president at RWJ Barnabas Health. So Wayne, please kick us off.
Sure, Javier. Well, first of all, thank you for having us here today. And we were deeply honored that President Williams and the Federal Reserve Bank team visited our South Ward project. And the way it really came about was a partnership that we made with RWJ Barnabas Health, who owns Beth Israel Hospital in the South Ward of Newark, to come together to think about how can we promote community and individual health in the community. Now, the South Ward of Newark, has some challenges with regard to, housing affordability, in terms of a number, more than 50% of our residents in that neighborhood spend more than 50% of their income on health. There's also older housing stock that is challenged with some, health and hazard type of issues. So we, at New Jersey Community Capital, just as a little bit of background, what we try to think about is how do we promote comprehensive community development through, as David mentioned before, investments in housing, investments in education, investments in economic development, living wage jobs, creating safe and vibrant neighborhoods. But we also know that, housing is the linchpin and the key to developing healthy neighborhoods. And so to us, it was a matter of how can we think about housing from both an equity and a public health standpoint. And JPMorgan Chase was promoting us to try to think about how can we think about reaching out to our healthcare anchor partners to do that. And so we were fortunate enough to have a visionary of Micheline Davis to be able to, connect with us and to develop a partnership where we decided initially that we were going to develop 47 units in the South Ward of Newark through a healthy home protocol and a healthy home standard. And we have a very robust kind of standard to do that. And we were trying to identify families who were, not only affected by mobility issues with the schools and others, but also, clients of the hospital that potentially, could benefit from a healthy home protocol. So when we went to Micheline and Barnabas Health, we asked for an investment in that project. And the first thing about that investment was they just didn't want to be a financial partner. They truly wanted to be a partner where they can really think about how do we really comprehensively think about this neighborhood from both a housing security and an equity standpoint, knowing that there's such a connection between healthy housing and an increase in social, educational, and economic outcomes. So we started out with 47 units, and they made a very generous investment in a fund that we created of $15 million. It was a low-cost, very patient fund. And we got rolling, taking the number of the vacant properties that were in that particular neighborhood, really developing them to this really robust, healthy home standard, and putting in families that would benefit from this type of housing. We started with 47 units. Right now, when I checked this morning, we're up to 91 and continuing to grow. So we see this as a model for future type of partnerships and collaborations, and it's been a privilege to work with Micheline, her team, and of course JP Morgan Chase. And I'd like to give a shout out to Michael George Johnson, who was one of the ones to help us do that. So thank you.
Good. So Micheline, what happened next? So Wayne contacts you. Of course you're in touch with Wayne all the time, but when you came across this project, what was it about the project that drew you in and made you a champion for this project?
There's so much about the project that just spoke to me almost spiritually. First of all, it's difficult to ever say no to Wayne Meyer. But that is because he is a trusted individual within the community development community that I have known from my prior work, actually, as Chief Policy Counsel to a former New Jersey governor. And I say that because really the work that I drive at RWJBH is through the equity lens, but it's led by the policy arm. And the fact that he was an established, known entity who I knew to be someone who is affable and easy to work with, but also, right, intellectually curious about how can we do what we have done before, but better, and what would this need to look like in order to truly be a healthy housing project, right? What do we do in order to ensure that we are looking at this? And so simultaneously, actually, Wayne and I were serving on a task force for a report for Thriving Cities, setting a new urban agenda. And in that vein, we began talking about what healthy homes truly need. What does a healthy community truly need? It's more than just making certain that you don't have lead coming out of the faucet, right? It's more than that. And so as we began to do that work, the more this gave us an opportunity to really concentrate with laser focus on the South Ward of Newark, which is where our hospital, Newark Beth Israel Medical Center, has been situated for about 120 years. Despite that, and despite the fact that there are two other hospitals within this same city of only about 300,000 people, that city itself still has the burden of Black infant mortality that is still worse than 3 third-world countries. And so our presence there was not going to be enough for the next 120 years. And this gave us an opportunity to figure this thing out differently, led by the felt need of the community, not just based on the data of our community health needs assessment, but with it, but also with the voice of the community that we are trying to assist in enriching, because they, if you listen to them, will tell you what they need. This was the opportunity to do exactly that.
Okay, so Abigail, in terms of the financing, how?
Sure. I mean, I just second everything Micheline said. This was really an extension of our partnership. As Wayne said, Michael and him had been working a lot of partnerships in New Jersey. We love the work that New Jersey Community Capital does, so it's a long-standing partner. That was first the important thing. The second thing, it gave us the opportunity to be a leader in the field, right? Invest in collaborations and engagements with anchor institutions that we know it's very important. So that was a piece that was really, really interesting for us. And then lastly, it's sort of a little bit of foundation speak, but it's a way to test and learn and scale models that work with trusted partners. It allowed us to unlock additional capital. We love that. In any way we can leverage our investments. That's something that was incredibly important in this pilot. And it was part of a larger partnership with New Jersey Community Capital to think about the state more holistically. So all of that was incredibly important. And, I should have said that none of these views are, the views are my own and none of those of my firm.
Ditto.
Somehow you always forget to say that. But lastly, as a business, we care about healthcare, obviously, not just, and I should say that this is part of a 1.75 billion commitment from the JP Morgan Chase Foundation to inclusive growth. So this is part of a larger portfolio. It was one of the first grants that was funding, exploring this intersection of health and housing. We have an incredible portfolio now, partnerships in DC, partnerships in the Bay Area, partnerships with the Urban Institute that put together a toolkit that really tries to tell anchor institutions, special hospitals, if you are thinking about being an impact investor, start with housing, and this is how.
Yeah. So I don't know if David gave the disclaimer, but yeah, that applies to us as well. So earlier today, and this morning, we had a roundtable discussion on corporate social responsibility, and one of the things we learned is that you have the CSR side, the business side, the foundation side, and sometimes they're speaking different languages, using different terms and different priorities. So Wayne, in terms, in your work in community development, when you approached the health sector, if you will, started interacting and dealing with the health sector, what challenges did you face? Was there a language problem there, or?
Yeah, that's a really interesting question, Javier. I remember, being at a meeting with our friends at the Robert Wood Johnson Foundation and talking to them about, their definition of healthy communities, and they really talked about 3 pillars, right? First, the house had to be free of all contaminants, right? Makes perfect sense. Number 2, the neighborhood has to be healthy, and how do you define that? Well, it's around education, economic development, living wage jobs, small business creation, parks, recreation, food, things of that nature. And I said, okay. And the third was housing affordability, because without that, that crowds out, and then there's a lot of great data on how that crowds out, people, forego prescriptions, doctor's appointments, things of that nature. And I thought to myself, well, in the 30 years in New Jersey Community Capital, that was the type of work that we were trying to do in our communities throughout New Jersey. And it struck me that how do we align together on that, right? And, and having Micheline to really be able to help us think through that was really a big part of that. But I think even initially when, they made the investment into our fund, it was a very, very affordable, generous investment, and we're going to pay her back. There was a little bit of language barriers in terms of, understanding the real estate part of it and the health part of it, and how do we think about what indicators can we capture to, really show that, we're making, we're measuring the data appropriately and the improvement in the health. But I think we've made great progress with that, and now we're involved in a transaction in New Brunswick together through New Brunswick Tomorrow, where we're developing a number of healthy homes in partnership again with Barnabas Health and so others. So we see that these partnerships are taking different forms. We're partnering in Patterson, I saw the mayor here around St. Joseph's, hi Mayor, Hospital, where we're developing 70 units of affordable housing and supportive housing. We're working with Trinitas Hospital on a shared referral. And so all these are different partnerships, right? And I think that as we continue and forums like this, quite frankly, continue to raise awareness of what types of partnerships are available in the community and what types of collaborations, I think will make all those challenges, if you will, or barriers, so we broke it down.
Yeah. And Micheline, from your perspective, what has been a challenge or the greatest challenge in this project?
So, it was wonderful to have Wayne talk about our other partnerships across the state. I should have said that the interesting thing about RWJ Barnabas Health is that we treat 2/3 of New Jersey's population, right? So 2/3 of 9 million people because of the scope and scale of our organization. As a result of that, we just find ourselves, and we are married to vulnerable populations. And in many areas of the state that have seen hospital closure, we really try to bear down and ensure that we stay there. And that is because what we understand is that long term, the community cannot be well without its access, undoubtedly, but now we also understand that they cannot be well without their voice. For us as an institution, however, it's interesting when you are the internal change maker. Other folks don't speak your language at all. And so I remember having conversations with the Treasury and Finance and having them look at me and say, why would a hospital do that? Especially because at that time, there were no hospitals in the state of New Jersey doing this. But my good friends across the country, I knew were doing that. And so what also attracted me and helped me to get over some of that barrier was the business model of New Jersey Community Capital. So when I asked who would be doing the construction, they indicated that Youth Build would be doing the construction. When I indicated that our anchor mission is also in order to ensure that small, minority, women-owned, veteran-owned businesses local to that community, to that zip code, also have vending opportunities, they said, yes, we have a list of local, small, minority, women, veteran-owned. So we were already mission aligned, and that helped, I believe, really to push the internal infrastructure that is a natural strategic tension of doing what we've always done, because that's what we are at least good at, and quite frankly, it's all that they knew, in order to get them to be intellectually curious about being able to do what others across the country are doing too, but to do it in our unique location as well.
Okay.
If I may, that's a really great point, because when Micheline and RWD Barnabas came to us, again, as I mentioned, they wanted to be more than a financial partner. They wanted to be a real partner at the table, figuring out, what is the beneficiary data that we can be able to capture? How can we think about things like community gardens and food? How can we think about economic development, workforce development? And 90% of the contract work that's been done on this $15 million project, scattered site project, has been done by local minority contractors. And we share vendors, right? So we think that's an also important part of the work.
That's great. So Abigail, in terms of, from your seat, in terms of the financing and, what role did CRA play in, as you kind of look at this project?
And I should say, there's actually a philanthropic commitment that we made to the project that got it started. So in that sense, we didn't have a lot of the sort of different speak and languages and terms, but what we'll say, what the challenge is sometimes is, how do you take this model and replicate it? How do we, share the extent and the successful partnerships we've had with New Jersey Community Capital and an anchor institution like RWJ Barnabas, and how do we replicate that across the U.S.? Because it takes a lot of work. Right, this was years and years in the making, partnership between, again, we said Michael and Wayne, long history there. And so that, for us, from the foundation perspective, that's really the challenge. How do you replicate? How can you make it easier the next time? How do you really share lessons learned, right? How do you not, sort of, what do you call it, like have a brain dead or, just intellectually challenging transaction? How do you take that from a model that could be scaled and replicated?
Good.
And it's about system change as well, right? And raising awareness. I chair the Federal Home Loan Bank of New York's Affordable Housing Council, and I invited Micheline to speak to both the bank and the Affordable Housing Committee. And Micheline's a force of nature. And after the meeting, the bank established a health and housing subcommittee. Now we're going through our community lending plan, and they're embedding health as an important part of the scoring to promote more of that in the neighborhood. So I think all of these little things add up to think about comprehensively, how do we collectively think about health in our communities.
So what type of, I guess, in terms of partnerships, what else would you like to bring to the table, to the next development or to this development?
So I think, like I mentioned, we started with 47, we're up to 91 in terms of that. I think, part of the challenges that we do is we identify tenants that can really use it. By the way, every tenant in these properties, and as we toured, right, they're really beautifully. We get a certification about it's completely free of all health and hazards and things of that nature. And our tenants don't pay more than 30% of their income to live there. And we got a lot of families. That's why we call it Family Village. But how can we think more upstream about what impact we're having on their health conditions, right? And that, we got a little bit of work to do on that, I would think, right? So, and how do we continue to identify families, respecting privacy and HIPAA laws and things of that nature, that would really benefit from that. But, we have a great partner in Newark in the South Ward Children's Alliance. They're a Promised Neighborhood grantee. They've been helping us with, identifying those tenants and families that would benefit from this. So, I think there's more work to be done in that regard.
Yeah. So in terms of, I guess, what stage is Family Village in? You have some that are in development, some, folks are families in Family Village now?
Mm-hmm. Yeah, right now, I think we have 63 units that have been completed. We just acquired, as I mentioned, another 30 or so. So, and we're continuing to, build momentum as we continue to do that. The one thing that drives us crazy, I know Micheline and myself, is that we live in a community where the housing affordability is such a challenge, and you're sitting with vacant properties that could be used to help alleviate that challenge, right? So how, that doesn't make any sense to me. So we got to continuously think about how do we secure those properties and repurpose them for the community.
Can I just add to that? Because I feel like that is such an important point, and it's why partnerships with CDFIs are so powerful, and partnerships with anchor institutions are so powerful, because you know the community, and you're sort of in the you're perfectly positioned to solve those issues, but it takes you, it takes the city, it takes partnerships with the state, it takes partnerships with funders to make all that work.
And if I may, and I'm sensitive to our time, if in fact you ask what other partners do you want to be involved in at any time, I will tell you, having the Southward Children's Alliance is a really important element of this, because of our work with the children and the families that are involved therein. But remember that so much of this began as a result of a principal talking about one of their greatest challenges. We thought that we were going to hear a variety of other things, and instead what we heard was the transience among her student population. Right. The fact that 2/3 of the grammar school turns over every year, and that children never get a chance to catch up on what they've missed as a result. So teachers can never fully teach a full curriculum. And so what we knew was that what doesn't happen is that children don't move by themselves. They move with families. And they're moving so much because they have parents who are housing insecure, because those parents are job insecure. And so partners who would be able to work with us on our workforce development initiatives, because we've now hired the parents and are training the parents who are part of the Southward Children's Alliance, because we get the fact that just one segment of this does not cure it. And that when you have historical, structural, and systemic issues, that you really need a comprehensive partner. And so we need partners who are willing to come on board and decide, yes, we will hire them too, and that this community, in order to be a community, needs to ensure that it has everything of every other true neighborhood.
Yeah, so there's that linkage to Newark 2020 and the hiring. That's great. So we have just a few more minutes. So before we close, do you have any final comments? Closing?
I mean, I think just to say that this intersection between health and housing is something we are thinking about. It's incredibly important. These types of philanthropic commitments, the work that we did with Urban Institute, for example, are things that our lines of business come to us and say, can I share this with my clients? So it's something that we care about as a company. And we're really just honored to have such great partners at New Jersey Community Capital to lead the field with this investment, and the opportunity to engage anchor institutions as well.
And thank you, Javier, and thank you to the bank for having us here today. I would say one thing. One size doesn't fit all when it comes to these partnerships. I mean, I think about the partnership we have in Newark and the partnership we have in New Brunswick. Same shared value, but different partnerships. The partnership we have at St. Joseph's in Patterson, same shared value, but different form of partnerships. Trinitas Hospital in Elizabeth, same goal, but different partnerships. So there are different ways that we can connect to both our hospital and healthcare systems to really make advancements in our community health. So it doesn't have to be just an investment. There can be other ways that we can partner together.
I think that that is a direct segue into the fact that, truth be told, thought leadership partnership is significant, and not to leave that on the table. Oftentimes people think, well, I've heard repeatedly, well, Micheline, you're asking us to boil the ocean. And I keep saying, I just want you to bring one bucket, right? One bucket. Get another person to bring another bucket. But really coming together in order to really have an opportunity to put your past experience and your intellectual curiosity together to figure it out is really a key component to what partnership should look like. And I don't want us to leave that on the table as well. And it costs you nothing, right? Except a little bit of your resource of your time. I think that that's a really key component. And then, of course, not to leave off of the fact that if, in fact, we achieve utopia in this one neighborhood, in that one community, that without actually making certain that we are also taking a look at the systems change required, right? Then it's actually truly not a long-term sustainable, equitable outcome possible until we literally remove the additional barriers. The great news is, because of the audience in this room today and the panelists that you have and this leadership, we know that we have what it takes.
Yeah, good. So we still have a few more minutes. Wayne, what is the role of the state government in this project? What role have they played here?
Yeah, so that's again another part of system change. And in New Jersey, our state housing finance agency has introduced a pilot program, which is designed to bring together partnerships on anchor institutions and community to develop housing, and both affordable housing and supportive housing. And there are 4 pilots that they are working on. One is in Patterson, another is going to be in Newark as well. And I think the response from the different health and hospital systems and from the community was so great that we see that this is going to become part of their normal process. So the other thing is that for the first time in many years in New Jersey, we've had our Affordable Housing Trust Fund fully funded, which is great. And as they thought about should those monies be used for, again, we talked about promoting this concept of health and housing as an incentive to our nonprofit partners to develop more. So again, I think this is all part of a system change approach to get everybody thinking along those lines.
Good, great. Well, thank you, everybody. Thank you for joining the panel.